Welcome everyone to the May Integrative Behavioral Health webinar on peer support and advocacy featuring Jody Freeholtz-London. Jody has worked in the field of human services for over 30 years. Her career has focused on mental health services in rural areas all over Minnesota. She has experience in chemical dependency, housing support, supported employment. She's a mental health practitioner, mobile crisis outreach, crisis stabilization, mental health education, and advocacy. Jody is certified as an advanced level facilitator for the Wellness Recovery Action Plan. She is also a certified peer specialist, an associate facilitator for the program, a trainer for mental health first aid, person-centered thinking, and a restorative justice circle keeper. Jody founded Wellness in the Woods, Inc., the statewide consumer-run organization, in March 2013 and identifies as having lived with an emotional illness. She is a fervent educator, public speaker, and advocate for mental health services in Greater Minnesota. Jody has served on the Rural Health and Primary Care Advisory Council and presently serves on the State Mental Health Advisory Council, the LAC Subcommittee, and chairs the Recovery and Community Support Subgroup. She serves on the Wadena County LAC and chairs the Region 5 Plus LAC. So welcome, Jody. We look forward to your extensive wealth of knowledge, and we look forward to learning from you. Take it away.
Thank you very much, Bridget, and thank you for the invitation. As I mentioned earlier, this is very much my passion and life mission to talk about mental health. It seems that no matter what I open on MSN in the morning, there's something about mental health that speaks to me, so I'm really pleased that I'm having the opportunity to chat with all of you this afternoon. As you'll note, the logo on our Wellness in the Woods welcome slide has a picture of what was originally the Tree of Life, but we wanted that copyrighted, so we changed a little bit. And you'll note that the branches and the roots are both the same size. And we purposely did that in that we believe that the individuals who are receiving services are as important as those providing services, and those people who are receiving services are as important as the people making decisions about what those services will be. It was my intent when I started Wellness in the Woods in the spring of 2013 to really become the voice of people with a lived mental health experience. And it took a while to get to that place, but you'll be able to hear more about that story as we move forward. So I do live by Nimrod, Minnesota, which has 69 people. I think even if it changes, people just like to have their picture taken in front of the sign that says 69, so it stays there all the time. And I've always lived in rural Minnesota. I actually went to high school and graduated in 1976 from Bertha Hewitt High School. And there were probably about 45 people in my graduating class, and most of them were also in my first grade class. So people didn't move around very much, and my knowledge of mental health was very, very limited. I knew that there was a gentleman who lived in our town, and when I would ride with my dad on Saturdays in his truck to town, that this particular gentleman spoke to people that we couldn't see. And I remember that there was some sense of fear and trepidation around him because my parents said, just stay away from him. I also know that in 4th grade, one of my teachers left during the middle of the year and went to Fergus Falls. Now, I didn't know what that meant except for that I knew that the town Fergus Falls was spoke of in the same hushed tones as Brainerd and Anoka and Wilmer, and that there was probably something wrong with her mind. But I was 9 years old, and I couldn't quite grasp what that might be. I also knew that I was somewhat afraid and inquisitive about the fact that she came back to teach. And she seemed just fine. She didn't look any different. She was able to teach just like she did before she left. But that was really my introduction to any kind of mental health challenges in my first 18 years of life. I have always lived in rural Minnesota and began working serving people in 1977 in long-term care. From there, I was able to work in a detox unit in a very small hospital that was located in Bertha. Unfortunately, it met the same demise as many small town hospitals, and after a couple of years of trying to reopen and stay supported, it was not able to maintain the level of income to do that. Unfortunately, that was also my introduction to my very first supervisor, who was fired for fraud or theft. I've had a long line of people who've supported and mentored me in how to not be a good manager. Nonetheless, from there, the options for employment, I had married a farmer at 18, and individuals oftentimes who work in agriculture, somebody needs to work off of the farm to supplement that income. And in our particular area of Minnesota, this was in 1977, so there wasn't even a McDonald's to work at or a Walmart, but there was long-term care, and eventually I found myself, after working in the hospital and running the detox unit, which was truly an experience and an education for me because I knew virtually nothing about supporting individuals who had chemical or substance use challenges. And I soon found out that many of the individuals that we supported during that time also had mental health challenges. We now know that what we call co-occurring disorders, or individuals who are struggling with chemical challenges and mental health challenges, happen quite frequently. I had the opportunity then in 1990 to begin working, providing supported employment in central Minnesota, and probably the individuals that I served, I would estimate that maybe 70% were individuals who had mental health challenges. And because of something that happened in their life, or a chemical imbalance or a trauma, that they were not able to work or not able to work in the vocation that they had chosen. And I think what really intrigued me at that time was that the individuals that we served were both male and female, and were of all different ages, and came from all different backgrounds, and were individuals who had nursing degrees and engineering degrees and lawyers, and that really opened my eyes to the fact that mental health challenges can impact absolutely anybody. It didn't matter our culture or our background or our income, but that mental health challenges were pretty prevalent throughout Minnesota, and even in rural Minnesota, where my world had been fairly narrow. I was fortunate enough that during that time I was part of what was an expanding community availability of services outside the regional treatment centers. And for many years, the RTCs had been where individuals with serious mental illness spent years of their life, sometimes their whole lives, being taken care of. And in the early 2000s, that began to change, thankfully, and programs like ARMS, the Adult Rehabilitative Mental Health Services, came into play, where there were a number of individuals that I had the opportunity to support move from those regional treatment centers into a type of assisted living, and then eventually moved into their own homes. I remember 4 gentlemen in particular who purchased their own homes and got jobs and drove their own cars and were important parts of their community, which is certainly something that I think all of us who have a lived experience with mental health challenges want. There were a number of things that happened over the next several years, including the fact that some of the agencies that I worked for were under some pretty in-depth investigation by the State Attorney General's office, and that was always quite traumatic for both the staff and the people that we served. And it ended up many times resulting in the whole organization folding, sometimes within a day. And not only did we not have jobs, but the individuals that we were supporting oftentimes lived in some kind of supportive housing, and so they had to really change what their staff looked like because they didn't have jobs to go to. In 2004, I was in a situation where I was a provider of services, and I was very concerned about the situation that I was working in, and I worked with the state of Minnesota for a number of months to help make some changes within that particular organization, which led to a lot of stress for me because it was some work that I couldn't really receive support from. It had to remain fairly secretive, and that really impacted my mental health. What happened during that next year of that whole kind of project and event was that not only was I working in a very stressful situation, but there were some difficulties within my family. Almost 30-year marriage was really very rocky, and I was not feeling safe in my home and in that relationship. And my faith community is very important to me. And so I went to my faith leader at that time and shared that I really wasn't feeling safe in my home and that I was going to stay someplace safe. And he decided that it was okay to share that with my now ex-husband. So some of those really important foundational pieces of my life just disappeared. And I became the person receiving services rather than the person offering services. That was certainly not a place that I ever intended to be, but I truly believe that my higher power had a reason for me to have that experience because it changed my perception, not only about services, but about how it feels to be the person receiving services. And honestly, I have to say that as a person who was providing services for many years, I thought I really understood the system and how to provide services well. But until I became the person receiving services, I didn't even have a hint or a clue of what that would look like. So that led my life into a whole different stream of advocacy. It led me into a life of being very passionate about speaking out for services that are not only adequate but are preventative and supportive for individuals who have mental health experiences. And now I was the person who was just like that. So that was a real change in perception for me. I did create a personal mission statement for myself that now included that experience in my life. So I was led to a job with the statewide consumer network at that point where I actually had to have a lived experience with a mental illness. They wouldn't hire me unless I did. And I worked with them throughout Minnesota as their director of statewide training until 2013. And then there was some concern about the future of that organization, and there were some funding challenges. And I was terminated from that position. Now, having a lot of knowledge about organizations that struggle, I was quite concerned about the future of that organization. And so I had to decide what I wanted to do, not when I grew up, but what I wanted to do with the rest of my life. And really in a very difficult time because I didn't have a job, an income. My second husband had retired from a position, and so we were just trying to figure out how to stay alive. And that was a real stressful, difficult time. And I could feel all of those mental health symptoms coming back. And I really knew that there were some important things that I had to do to not only maintain my own mental health, but also continue serving people throughout Minnesota. So in the middle of the night, literally, I came upon the name Wellness in the Woods and kind of rolled over and poked my husband and said, I think we should start a nonprofit that is the voice of people with a lived experience and also to represent individuals in greater Minnesota. Because oftentimes those decisions made about our services don't go much further than St. Paul, and we don't have the opportunity to have input on that. And so there we were. We started the next morning. He and I talked about that, and he said, yes, this seems like a good place for us to go. And so we did. we began Wellness in the Woods and found some board members who believed in our passion and created a mission, a very simple mission statement that was to be the voice of individuals with a mental health experience. Now, a couple years into starting Wellness in the Woods, we changed that mission statement to also add that we want to fortify opportunities that positively impact and inspire communities and support systems, because we know that as individuals with mental health challenges, we can't be healthy without our communities supporting us. And for us to be able to get that support, we have to do a number of things that I'll talk about that help our communities to be knowledgeable and to share what it's like to not only receive services, but the fact that many, many individuals in our community will at some point in time need those same services. Our vision is very simple, is to foster and embrace acceptance of all life experiences. We now have at least the knowledge that we know that mental health challenges and mental health and mental wellness is oftentimes has been impacted dramatically by trauma or life experiences, including our environment and what that looks like. So we just know that what's happened happens, and what are we going to do with that? And we absolutely accept whatever has happened in people's lives and support them in whatever direction they want to go through. So we came from, CSN was actually the statewide consumer network from 1994 until 2014. But we had great concerns that there was no rural input and really no opportunity for consumer voice from greater Minnesota. We also know that there's just frequently not consumer voice and or leadership throughout the implementation and provision of services. And there's often a lack of recognition of the consumer voice, both at organizations like the Department of Human Services and the Department of Health, but also legislatively. And so we felt that it was really important that we have that input. We also knew that individuals, when the former organization dissolved, it actually merged, but virtually dissolved as a consumer network, that people needed to have an organization that came back and talked about high standards of ethics and service provision, and that we were looked upon as individuals who are, for lack of a better word, elite, that we have now an experience that that 25% of our world is experiencing, but that we have something special that's not necessarily a barrier in life or a limitation, but instead is something that has helped us to learn, to grow, and to create some pretty great coping skills. And so we believe very much in empowerment as well as personal responsibility. So we've identified as an organization, and we provide services and outreach throughout the state of Minnesota. Some of the things that we have identified as very important to individuals with a lived mental health experience, which you'll note is actually not very different from what most individuals who live in our communities want, is that we want respect, we want choice in the services that we have available. We want to know that we have opportunities to make a choice as to what services we want and how often we want them and what they should look like. We also believe that empathy is extremely important, in that not only that you listen to me, but that you hear me and that you provide me services with dignity, and that I'm accepted, and that I want to be part of our community, that individuals who have lived mental health experiences have jobs, get married, have families, pay taxes, and are just part of our community as any other individual would be, and that we need adequate services to make that happen. And that may change throughout our lifetime, and that's okay, because as we change and we are more flexible, we know that our services also have to be flexible. So what do we need that's missing? So I've been working in this field for a long, long time, and thankfully the state of Minnesota is far and above many states in the provision of mental health services. But some of the things that we note in Minnesota that are missing are levels of care before we reach crisis. I have the distinct opportunity of doing facilitation for the day-long mental health first aid training. And when we talk about when to use that, it's when somebody first starts becoming unwell. And also we look at the resources that are utilized to support individuals who are in crisis. And yet most of us don't want to be in crisis, but there's not much out there that helps us to be well, and that is in preventative care. And for the most part, most of us want to be in that place where we're well. I use the example of the fact that every morning I take medication for high blood pressure, and I would much rather check my blood pressure, take that medication, than go into rehab if I have a stroke. And most people that I know who have mental health challenges also want that level of preventative care. And yet we know that service providers are not compensated for preventative care, and we have to be in a level of crisis before they're compensated. So we really know that that has to change. We also expect and know that there needs to be recognition as a person and not a diagnosis. We also realize that compensation for services are often focused on BRASS codes and DSM codes, and that there has to be something really wrong with us before we can get any kind of support. And we know that that's a struggle for both people providing services, but also for those of us who need those services early on. We know that and realize that services have to focus on quality and not just outcome. And we haven't exactly come up with really good ways that we can measure that. Measurable goals, measurable outcome are all the time about numbers. And we don't have a really good way of focusing on, was that a quality service? And how do we make that happen? We're certainly seeing some changes in service provision throughout Minnesota, and we as individuals who use those services are pretty consistently asking that that be measured. We also know that there's a great deal of stigma that impacts individuals across Minnesota, both asking for services and receiving them. So I looked at the hospital that's closest to me happens to be Tri-County in Wadena, and they did some work and did a risk assessment a couple of years ago and asked people why they don't ask for mental health services. And the number one reason was stigma. Individuals did not receive or ask for services because they were afraid of what their friends, their family, and their neighbors would say. Stigma is alive and real across Minnesota as well as across the world. And we believe that it's really important that we continue to educate everybody in Minnesota about mental health challenges. Number one, because we don't know who it will impact. And number two, the more we know about a situation, the better we can support people. I use the example of my daughter, who is 33 years old and was recently diagnosed with diabetes 1. And I knew nothing about how to support her until that actually happened in her life. There had been no one in our family who had struggled with diabetes previous to that. And so I had to do a lot of research about that. And so we hope that we can provide information and education to individuals across Minnesota so that they can provide support to individuals who may be just struggling in the very initial stages of mental health challenges, and we don't have to get to that level of crisis. That also means that we as communities need to step forward and get beyond that stigma and that fear of reaching out and helping people in a level and a diagnosis that's sometimes very fearful to talk about and very fearful to ask about. We also know that many individuals who work in entry-level mental health services get very little training. They're trained very little. And we also understand that the individuals providing that services as well as the organizations don't have what they need for income levels to be reimbursed to pay people more. So we know that's a problem, which then also leads to the huge workforce healthcare shortage that we are seeing. It absolutely breaks my heart as I travel across Minnesota, and I put about 50 to 60,000 miles a year on my little red car, and hear that there's another service closed down because we can't get help. So we know that's a really big problem, and we know that people aren't getting services and aren't getting the care they need just because people need jobs that can feed their family. What isn't working? We know that services are continuing to be developed without asking us as consumers what works for us. And I have this conversation frequently with individuals who are creating services, including individuals in St. Paul, our legislature, and say you need to ask us what we want and need, because we have seen over the years that services have been created and then they don't work. And we all sit around brainstorming asking, now why didn't that work? And one of my answers is pretty consistently, did you ask people what they want and need? So we think that that's very much at the top of the list. We also know there's poor communication between decision makers and people using services. So whether it's the Minnesota Department of Human Services, the Department of Health, legislators, county and local government, there is very little opportunity for individuals using services to give feedback. And even when there are opportunities, those of us in greater Minnesota don't always know about them. So that's a real concern. What has happened because of that is we have pretty consistently as an organization gone back to those decision makers and say, we want a seat at the table. It's really important that you listen to what we have to say. And thankfully, that's happening more and more. It's been a bit of a consistent push to do that. But once decision makers understand that we're there to make services better for us, but also not to make their lives miserable, it's just to give input on what's going to make everybody's life better and our community a better place to live. We know that there are not enough preventative care services, and I talked about that a little bit earlier. There's not enough beds for crisis services. The gaps analysis meetings that have been happening around the state, those are one of the very top things that are being brought up, is that there's not enough beds for crisis services. My hope is that we would not need all of those beds for crisis services should we have enough preventative and community health care services. I am waiting hesitantly and anxiously about what the final omnibus bill for health and human services is going to look like when the special session is over. So you can bet that as soon as the webinar is over, I'm going to be checking to see what's happening with that. We also know that jails are being used instead of mental health services, and there may be some pushback on this, but there's certainly a lot more focus on metro needs, certainly because there's more people there. But those of us who live in greater Minnesota have more unique needs, that one of those being transportation and lack of services in greater Minnesota. So we want to focus on all of those, and we seek pretty much consistent feedback for anybody who is either receiving or providing services so that we can advocate for change in that. So what are we doing to make a change? Well, I'm not the person who is standing on top of those hands. Maybe it's one of my staff, but we're very much a part of a fervent advocacy organization and believe that our voice is very important to hear. So a couple of years ago, we were really grateful that Blue Plus came to us and gave us some dollars to do QPR, Question, Persuade, Refer, Suicide Prevention training. And that is presented by peers. The individuals who are trained, this happens to be Jess and Steve, who are both trained QPR trainers, and they travel throughout Minnesota. We actually have 10 people who are trained to do question, persuade, refer. It's a 1-hour training. It's evidence-based, and we present it from the view and the perception of individuals who have used mental health services. We have probably trained over 2,000 people in the last 2 years in QPR, and also work closely with other entities who do that, so that if we're not able to provide that service, we can refer them to somebody else. We know that suicide is a huge problem in Minnesota and continues to grow, that in 2015 we lost 715 people to suicide. We know that in that year we also lost the youngest person was 6 years old. We continue to lose veterans. We also see an increased number of rural adolescents lost to suicide. So our goal is to do outreach to schools and faith communities, governmental leaders, and community members, because we believe that everybody has a part in saving lives in other people in their communities. I find it really difficult and disheartening that oftentimes we will get together and do awareness walks about suicide where hundreds of people show up, but then we provide services and education on how to prevent suicide, and we get a handful of people. And when I asked about why that happens, the response was, well, we don't think it's going to happen in our community. But unfortunately, it does. And we want people to be ready to know how to support individuals so that it doesn't continue, that number doesn't continue to grow. Another thing that we do is we got a small grant from the Minnesota Department of Human Services to fund mental health first aid. And I'm fortunate enough to be one of the trainers to do that. And so we use the curriculum for mental health first aid, but I'm also able to use 30 years of experience from providing support to individuals and using my own experiences in providing support, but also receiving support in what works well for us. We were fortunate enough to get a 2-year grant to do that, and we accomplished all of those mental health first aids in 6 months. We're able to get an extension to our grant and now have completed them all again. We also provide mental health first aid to adults who provide services to youth. And I enjoy that. We have one more person who is trained and are hoping for additional funding because we have lots and lots of people who would like that. Some of the partnerships that we have created and offered mental health first aid to have been city and county employees, hospital staff. Essentia in particular has invited us back several times to do training. I went to Boston yesterday and did a 4-hour introduction to first aid, have worked a lot with Essentia in the Fargo-Moorhead, Detroit Lakes area. We have law enforcement who comes to those trainings, educators, any community members who want a basic mental health information and to know how to support a person who's struggling. So the individuals who come to mental health first aid are moms and dads and brothers and sisters and faith leaders and bartenders and beauticians. So we have a new contract with the Association of Minnesota Counties, and we will be offering them in 7 different areas of Minnesota an introduction of what mental health first aid can be, and that we hope that we will be able to provide them with some ongoing services if they think this is worth the effort and the expense to come to any county in Minnesota. And so we are looking at training a couple more people. We also believe that it's very, very important that we do outreach to emergency responders and individuals who provide high-stress jobs like law enforcement and ER nurses and individuals who work in crisis services and volunteer firefighters, because we are seeing a lot of those individuals who are dealing with their own mental health stress because they're in a place where they are dealing with stress every day and they don't necessarily have a good support network. And we need them to be there, and so we do some special outreach to emergency responders. We've also created some other services to do some expanded education. We have offered the suicide prevention to faculty at several colleges, and we are creating a curriculum for ongoing training for dispatchers. That's twofold. One is how to support the people who are calling into the dispatchers, but it's just as important how to care for yourself and how to be well so that you continue to do that job so you can support me when I'm in crisis. We're also working to start partnering with the Minnesota Department of Health and have had some ongoing discussions with some folks there talking about the new Garrett Smith SAMHSA grant with suicide prevention. And so I have a couple of staff and myself who are going to be on those work groups and that task force to see how we can partner with MDH to move forward and connect with young adults. And we know that there's been an increase in suicides for young adults, and we want to really use our expertise in Greater Minnesota and as individuals who have used services and have a lived experience to be able to partner with them. So we're pretty excited about that. All of my staff and all of my board members have identified as having a lived experience with the mental health challenge. We also have growing partnerships with the tribal entities throughout Minnesota. My former board chair is actually from White Earth, and then we actually have 10 board members now, all of whom have a mental health lived experience. We have a couple of veterans who are on the board of directors, and that continues to grow as we continue to grow. So we want to be culturally sensitive as well to the communities that are in Minnesota. We have a new partnership with New Americans, and we're going to be providing WRAP, the Wellness Recovery Action Plan, for Somali youth up in the Moorhead area. We were originally connected to a group called the Afro-American Development Association in Moorhead, and they liked our Facebook page. And so I called and said, "So, Hakoon, what do you do?" He said, "Well, we help people who are new Americans to find jobs, and we help them find housing." And I said, "You talk about mental health?" He said, "Nope, we don't talk about that." And I said, "Would you like to?" Because I can imagine that moving from a different country to ours could be pretty traumatic and pretty stressful. He actually moved to Moorhead, Minnesota from Kenya in the winter of 2014, and I asked how that was for him. He said it was pretty difficult because I slipped and fell on my butt 3 times before I was even off the airport. So we talked about that, and they invited us to come back and do mental health first aid for a number of people for their community. And these are just a few of the graduates from mental health first aid, but this has created a really warm working relationship with New Americans that we want to continue to expand and are excited about providing the vocational WRAP this summer for Somali youth as they are preparing to go into new jobs. We also were blessed to get grant funding from the Five Wings Art Council, and we had thought about different ways that we can promote education around mental health, specifically around suicide, and we're fortunate enough to get this grant and work with a wonderful human being, Haley Honeman, who is a playwright and has her master's in art and design, and she actually spent a lot of last summer interviewing 75 people to get their stories on the impact of suicide. What's been created out of that is a dramatic event called the Acts of Solace, and the first time that we're going to be presenting that will be in Wadena, Minnesota, the first part of June. The actors have all auditioned and have been practicing for the last 2 weeks. It is our hope that once we have done this within the region where we got the grant from, that we'll be able to take this into other parts of the state. I remember that I was not able to be one of the actors because of the time commitments, but when we did the first couple read-throughs, it was probably one of the most impactful events that I have ever been part of because I recognized those people. I recognized the words, and I recognized the pain and how to be able to move forward. So we're pretty excited about the first opportunity of that happening. And you can find more information about that on our website, which I will share with you shortly. We've also done empowerment events across Minnesota. That will be the focus of our 5th annual conference this year, which will be held in Motley, Minnesota on September 23rd. We believe that for individuals to move forward into recovery, they need to be empowered and that they have to take personal responsibility and self-advocacy for the opportunity to move that forward. That recovery is not just somebody handing us a pill and hoping for good things, but that we have to be very involved in our own recovery. And to do that, we have to ask for what we want and need from our community and from our providers. We also are trainers in the Wellness Recovery Action Plan, which certainly helps me to be as well as I possibly can. I will be attending the refresher course for advanced level facilitators the first week in June at Wrap Around the World. And then we hope to have one more person trained to become an advanced level facilitator. So not only can we assist individuals in creating their own wrap, but we can train trainers, which is what this particular class was. The lovely woman on the front on the right came to us from Washington, D.C. and helped me to do this particular class last year. We were fortunate enough that we have the start of some wrap training in Minnesota, and now under our federal grant have been able to continue that. So this is our annual recovery conference. We hold one every year. It's always held in Greater Minnesota. This was in Brainerd last year, and we usually have about 130 to 150 people attend. It is very focused on recovery, and all of our speakers are individuals who have a lived experience with a mental health challenge, and we have breakout sessions that just give information on how to be well. We don't have any breakout sessions on any medical models. It is all from a recovery and from a perception of individuals who have a lived experience. And as you can see, we have a very, an audience that is listening to every single word that we have to share. We have everything from Tai Chi for seniors to music therapy and how to make your own tambourine. This year we will be sharing the Acts of Solace dramatic event at our conference, and we have a couple of really great keynote speakers and breakout sessions, and of course, being good Minnesotans, a lot of really good food and a very reasonable fee. A year and a half ago, there was an opportunity with the Substance Abuse and Mental Health Services Administration to apply for a federal grant to become the statewide consumer network in Minnesota. 7 states were able to be funded for that. And so this was at a time when our organization had very minimal income through very minimal grants, and that my grant writing was not at its best. And so we decided, the board and I decided that we were going to at least give it a shot. And for those of you who have written federal grants, you can feel my pain. So I spent about 3 weeks, because we didn't have the money to hire a professional grant writer, about 3 weeks just pretty saturated in putting our heart and our passion into writing this grant. And we submitted it with a lot of hope and prayer, and 6 months later, we found out that we were accepted. What that means is that we are just finishing up year 1 as of June 1st, and that has allowed us to, number one, it allowed me to get paid, but number 1.5, it allowed me to get staff on board, and all of those staff are individuals who have a lived experience and are located throughout the state of Minnesota. Some of the work that we do under that, besides building the capacity of our organization, is support the Certified Peer Specialist program in Minnesota, which I am a huge fan of, not only being a peer specialist, but a facilitator for that program. And now we are creating a specific membership program for the peer specialists so they can be connected and so that we can tell the rest of the service providers how important it is, the work that we're doing, and expand the work that we can provide. We provide the Wellness Recovery Action Plan, mental health first aid, and suicide prevention training with limited numbers under this SAMHSA grant. So we're pretty excited about what what that looks like and how much that's brought us this past year. In October of 2016, we were working with Todd and Wadena County, and we started a warm line. We talked to individuals who live in those two counties where there's a pretty minimal amount of services, especially with peer support. And they told us that the time that they really need more peer support is oftentimes overnight, the overnight shift, like from 10 to 6 in the morning, not necessarily when they're in crisis, but just when they need somebody to talk to. And so we started the Peer Support Connection Warm Line with Todd and Wadena counties, and as of April 1st, that has moved to 6 different counties of Region 5, so Todd, Wadena, Crow and Cass, Aiken, Morrison, and two tribes, which includes Mille Lacs and Leech Lake. We are certainly open to adding other counties to that now that we have staff trained. All of the staff who offer that support overnight are also peer staff and have a lived experience with a mental health challenge. We were fortunate enough to partner with CentraCare in St. Cloud and provided a trauma conference on May 1st, once again using all peers to tell their story. And the reason that this trauma conference happened was because there were peers that I was talking to saying, you know what, I go and get services and I'm a survivor of trauma, and yet not everybody knows how to support me. And so this particular conference, which we're hoping to replicate in other places in Minnesota, brought together some wonderful speakers, including Olivia Janice, who is a professor at the White Earth Tribal College and is an excellent speaker on the impact of trauma to our body, mind, and spirit. And we brought Eva Deck from Georgia, who came and spoke to us about how treatment can sometimes be more traumatizing than treating. And then we had a number of individuals who were victims of trauma and shared their story about what we can best do as providers and as community members to support them. So the Certified Peer Specialist Program, which I am absolutely blessed to be part of, with the first class of 20 in 2009. There are now over 600 trained CPS graduates in Minnesota. They offer billable services in ARMS, IRTS Act, crisis stabilization, and now the new certified community behavioral health care clinics that are opening throughout Minnesota. It's a billable service where my experience as having a mental health consumer is actually a place where I can be paid to provide that service to other people. It is 2 weeks of intensive training after an application and an interview to be able to be part of that. The 2 weeks is equal to 3 college credits, and it really is preparation for employment. The whole goal is that individuals who go through that class are then ready to go out and get a job. So the curriculum for peer employment training really is about a change of perception for the people who are in there. We talk a lot about recovery language, cultural sensitivity, how to tell our story, what are the values and ethics that surround utilizing our story to support other people. Their midterms, finals, attendance, participation are all graded. Some more opportunities that we've had to partner. We we have visited all of the adult mental health initiatives throughout Minnesota, have many county partnerships. We are oftentimes partnering with other service providers. We look to other service providers and partners to be sponsors for our conference every year, partner with hospitals, mental health centers. We partner with employers to provide training for their staff. We encourage peer support not only in those billable services, but we believe that peer support can be very important. As somebody who is a receptionist, we would love to see peer support available in emergency rooms, as we are well aware that ER visits due to mental health challenges have increased dramatically. We also give feedback to state organizations like the Department of Human Services on their crisis line creations. We're part of the State Advisory Council the Mental Health Advisory Council Work Group, the CCBHC Program Development, the Mental Health Action Group, and Minnesota Department of Health Suicide Prevention. And we are waiting with bated breath to see if our legislature is going to give us some planning dollars to provide the very first peer respite in Minnesota. So what we are hoping for is the opportunity to buy this lovely house, which we are going to call the Lady Slipper Respite. All of the staff will be peer support specialists, and individuals who stay here do not necessarily have a diagnosis. There are 17 other states that have peer respites, and we hope to bring the very first one to Minnesota where individuals can stay for 1 to 5 days. They do not get any kind of medical model support. It is only support provided by certified peer specialists and is a place to stay for just a few days. So we don't do diagnostic assessments. We don't do med management. We just provide peer support. So we're anxiously awaiting to hear how that's going to move forward. This is our new website, mnwitw.org, that was just put together a few months ago, actually. I'll bring that up and I'll bring that back in just a second. But other things that are happening, we have some opportunities to start doing some work in Puerto Rico. We're hoping for the first peer respite in Minnesota. We're also hoping to work with SAMHSA more closely and provide some of the brass tax services that other states don't have. We are just entering into a new program providing services with the Minnesota Department of Corrections and the Mental Health Court. We're hoping to have more expanded partnerships with communities of color. We have also created a membership program and I'm Here pins that we share every place we go to let people know that we are open and willing to talk about their mental health challenges. And we are looking forward to working with the St. Paul Diocese and hope to create a warm line specifically for individuals who have been victims of clergy abuse. And in our free time, we are just always open to ideas and ways that we can connect with new partners. So we have a couple minutes yet if anybody has questions.
Hi, this is Alyssa with Rural Health Innovations, and thank you for providing all of this information. I do have a follow-up, just a couple of questions. I see Carly is typing in the chat box right now too, but many of our grantees are focusing on community education. So Jody, I'm not quite sure how familiar you are with, but all of the hospitals that are on the line and in this project have done some review of the needs of their community and have done some community strategic planning with behavioral health providers, other organizations, anyone that may have a touch point in people's lives that have different behavioral health needs. But almost every one of the hospitals in their communities came together and said, you know, we need to focus on community education to help reduce stigma. What is some additional advice that you can provide on how they can do that? Like some of the activities that you've seen work or have done. I know you've talked about asking consumers to be what they need, but what are some specific actions or activities that they could look at doing?
I'm going to re-emphasize that fact about asking consumers because providers can all get together and come up with great ideas, but until people what they want and need, we don't know that that's what people want and need. So inviting those individuals in right from the very beginning, the very foundation. I also that training like mental health first aid, just because it's very foundational and everybody can understand it and that it's made available to anybody in the community, that makes it a community responsibility and not just the responsibility of the providers. I think we need more of our communities to get involved and take responsibility because the reality is that providers are not always there and our community members need to be aware that they have to step up to the plate too. And it's not that difficult. It's just being a caring compassionate human being.
Mm-hmm.
Get that change in perception.
Right.
So the response is
And
like, well, it's not so hard.
And that's what I know they're focusing on. So how would you recommend that they invite them to the table? I mean, what is that? Is simply as putting. What are those? How do you invite folks? Because obviously you can't go into your record and look for people with a behavioral health diagnosis and target mail them and stuff like that. But how are those invites going out?
So what we try to do is focus with groups that have already identified. So
Okay.
it might be a NAMI organization. It might be a drop-in center. It might be, those of us, and we have a lot of connections. So I would absolutely invite people to connect with us, and we might just be able to guide them because that's who we connect with is people receiving services, and we can kind of say, hey, you know what? There's a group in Ely or Rochester who's looking for input from people who receive services. Oftentimes we will get people who will do that. We also really want to validate that the time that they spend is not only be validated, but be compensated.
Thank you. No, that makes sense. That was one of my questions too, is if they could outreach to you to connect for some further exploring. So thank you for answering that too. Are there other questions?
Hi, this is Carly calling, or talking from Rainbow County Hospital. I was wondering how it would be possible to get our community or our county involved with the warm line.
If you are interested in doing that, to add a county to our warm line, I'm just going to be really clear about what that is. To add any county to the warm line, it's $500 a month. You connect with me, rewrite a contract, and we start providing services as well as outreach and marketing information to your county. All you have to do is email me, and if you can get folks who are willing to do that, we are more than happy. We have a number of counties who are considering that right now, and we have the able to do that. So if that's something that a county is interested in, we are expanding that.
Okay.
Has there been good utilization of the warm line?
We just, until April, we only had 2 counties.
Right.
That's consistently growing as we continue to get the information out. And places that we share that information is in ER rooms, at mental health centers, at health fairs, at county fairs, at we just make that available in laundromats, any place that there are people, and it's growing every month. It's growing every month. Yep. Are there any more questions?
All right.
Not
well,
pleasure.
Thank you very much for your time today and everyone's time.
Thank
Yes,
you.
thank you so much, Jody.
As questions, or you can check us out on the website, and we will almost always get back within 24 hours. Well, thank you, Bridget and Alyssa.
Thank you.
Yes, thank you all. Just a couple extra poll questions at the end here.